Good afternoon, good morning, good evening, or good night, depending on which part of the world you're in. This is Ernest Odell, and I am going to make an industry-specific presentation for insurance professionals. I've done several others on ACN for real estate, communications, telco, unified communications, which I have been in for the past 40 years. And I want to make this one specific for insurance professionals and for a gentleman I just met today over at Walmart at one of the insurance tables. So let's get started. My name is Ernest Odell, and I am going to jump over to screen share, and we're going to go into the full screen share. And now I'm going to go back over here to move this out of the way. All right. And now get over here to the presentation. Okay. And go in here and start the slideshow real quick and take you through the first few slides, give you an idea. ACN started back in 1993 when they had one product, and that was long distance. They were selling telecommunications. It was known as the American Communications Network. But since they have added other essential services to their line, they changed it to just ACN. Okay, this is a readout statement disclaimer. Refer to the ACN compensation plan for complete details. Earning an income as an ACN independent business owner is based solely upon the successful sale of products or services to customers and their usage of those products. Individuals will incur expenses in operating their ACN business, such as the sign up and monthly business support fees, as well as other possible operating expenses. As with any business, earnings and success at ACN are not guaranteed, but depend primarily on the individual's persistence, effort, and results of acquiring customers and building a team, I might add, personally and or, as I say, through their team. Individuals will not earn an income and will lose money as an IBO if customers are not acquired. If you sign up and you do nothing, you will make nothing. This is a picture of the corporate headquarters in Concord, South Carolina, North Carolina. I got to find out. It's up there by Charlotte. They own this building and the property. They do not rent all 1, 2, 3, 4 floors, and I think they have a 5th floor in the back. But our business is customer acquisition for home and business services. These are essential services, and I'm going to show you these in a minute. It's established back in 1993. They have acquired millions of customers over the past 31 going on 32 years. And they have paid out, not only have they made billions in sales, but they've also paid out billions in commissions. We are also have accolades and recognition from Inc. 500, the Direct Sales Association, the Better Business Bureau, Private Titans, and the Direct Selling Education Foundation, DSEF. We've gotten some accolades from them. The Direct Selling Education Foundation has featured us in some of their stories because we have constantly maintained the top standards of training and education in the field of direct selling. We focus on essential services. These are services that you can't do without. If you don't pay your electric bill, the lights go out. No electricity, you don't have internet, you don't have power to charge your phone. If you don't pay your phone bill, the phone gets cut off, a lot of things, okay, including the internet and television. We do focus here in a lot of open markets where they are deregulated. We sell Zoom energy, gas, and electricity. We also have impact health sharing, which I will get to in just a few minutes, for you insurance professionals who are selling insurance. We also have ID seals. So if you're familiar with the latest data breaches with AT&T, Wells Fargo, some of the banks, some of the hospitals have been, hijacked and held hostage with ransomware. And on a personal basis, ID Seal is much stronger than other leading names. It's military encryption, it's mil-spec. Vivint Home Security, some of the best home security you can have. ADP is automated data processing for payroll and HR. We have Intermedia Cloud Communications, which is our unified communications. NMI is credit card processing. Though there are a lot of services, residential and business, these are just a few of our partners. Oh, and also mentioned here, every time we sell a new customer is acquired, we donate a certain portion of our profits to the Project Feeding Kids. So this is a real good charitable event. And on the corporate side, anytime that we have the conferences, we donate a lot of money to the Ronald McDonald's House in that area or in that city. This is where we're going to get into the part about health sharing. Health sharing is a concept that started way back in the 80s. It works better, feels better than insurance. You get the same care and less cost. And we save a lot of people a lot of money. We have people that have been paying with other insurance companies upwards of $1,000, $2,000, $2,500 a month, sometimes in premiums. They switched over to Impact Health Sharing, and they have been saving anywhere from 30 to 50%, sometimes 70% or more. I'm going to play a video for you here and let Phil Chrysler give you some information in this video. So when he gets through, we'll come back.
Hi, I'm Phil Chrysler, President and CEO of Impact Health Sharing. Healthcare sharing and in churches. You were asked to contribute to help Bob and Sue with their ailment. People passed the hat and you contributed what you could to help your fellow member in need. Then fast forward, you saw great things occurring in the Amish and Mennonite communities doing exactly the same thing. Then it got a little more formalized in the 80s with some religious-based organizations. And then the Affordable Care Act came along. That's really what propelled healthcare sharing to its modern day growth. You remember the individual mandate penalized you with a tax if you didn't have health insurance. But if you were a member of certain healthcare sharing organizations, you didn't have to pay that. Now we know the individual mandate has, of course, been reduced to zero. But in the meantime, healthcare sharing grew over 1,000% in the last decade alone. Why? Because it's an alternative to the high cost of insurance. Typically, you'll pay 30 to 50% less. Some reasons why: we're not for profit. So we have no profit motives that typically cause conflict between members, providers, shareholders, and the executive team. None of that exists with healthcare sharing, and certainly with Impact. You can stop overpaying, my friends. Here's an important statistic to understand why. Department of Health and Human Services says about 5% of the population account for nearly half of the healthcare spending that occurs in this country. Majority are healthy. They're overpaying, though, for the non-healthy. Insurance has become really no longer affordable. 80% of US adults rate lowering their healthcare costs as their top concern. So why Impact? Well, we're rooted in the love thy neighbor approach, which allows us to welcome all races, all religions, all colors, all creeds. We were the very first healthcare sharing entity to launch this patented technology platform that really provides 100% transparency. This had never been done before in healthcare sharing, certainly not in health insurance. We have member-owned accounts. That way the money stays in your account. We have no network. You get to see any doctor you want. Again, providing full transparency on how all the money moves is something we're really, really proud of. And of course, you have no open enrollment restrictions. Membership begins the first of every month. You just got to finish that application by the last day of the previous month. We also have great pricing and programs for individuals, for families, for seniors, and for groups. And remember, friends, it's a comprehensive program for your health. So we have preventative services, maternity, accident, illness, and of course, injuries. You have access to telemedicine and an industry-leading prescription drug pricing program. Here is a quick video that highlights the opportunity for all of us to be a disruptor in the industry. Enjoy.
Healthcare spending made up 5% of total US GDP in 1960. In 2020, spending hit almost 20%.
National polls show Americans believe healthcare prices and drug costs are among their top pocketbook concerns.
Over the past 20 years, the runaway cost of health insurance has outpaced earnings and inflation, leaving our families with less freedom and less money. Families, small businesses, and individuals alike are struggling to find a way to pay for the health care they can't seem to afford. So how are we going to solve this problem? All over the world, technology is changing the way people and society connect and interact. The result? Countless industries are disrupted. But while the rest of the world has changed, insurance and the way we pay for healthcare remains broken and largely the same. What if there was a way we could all pay for healthcare that simply worked better and felt better than insurance? Well, today there is. We are Impact Health Sharing. We are a network of families, individuals, business owners, and small entrepreneurs who want to see the old way of doing things change. We use technology to connect tens of thousands of individuals and families across the nation to simply share and pay each other's medical bills. Old problems can be solved when people come together to leverage their sense of community with technology to control the cost of healthcare.
My friends, what we are simply doing is leveraging your sense of community with technology to control the cost of healthcare. I hope you'll join us.
And in comparison to what you find in the traditional health insurance model, you have high monthly premiums where with Impact, we can save them 30 to 50%, and in some cases even more. You have a high deductible per family member in traditional insurance, whereas the PRA, which is the primary requirement amount, is on a per household basis. So you can have one or two people in the household, you can have 5, 6 people in the household. It's not deductible per occurrence per family member. This is per household with impact sharing. In traditional health insurance, you have networks of physicians and facilities and hospitals and clinics that the member of that health insurance plan has to choose from. With impact, you can choose your own facility or your physician. You can stay with the physician that you're already with. If you like them, you're not stuck with a network. In prescription pricing, we have lower pricing and a portal where you can go in and get your drugs where they're a lot cheaper than your traditional health insurance. We have in the impact model lower co-pays, co-shares, and provider fees, whereas you find in the traditional health insurance, you find them a lot higher. When you need to call a doctor on their telehealth system, not all insurance companies have that function. It's not available. And those that do, it's an extra cost in many cases. It's not free. There's very few insurance companies out there that I know of that provide free telehealth. If you have something, where you don't have time or can't get to a facility or an emergency room, and all you need is a prescription refilled, you can call in 24/7 to the Impact Health Sharing telehealth, where it has a $0 fee, totally free. In traditional insurance, it does not cover migrants in the US. Now, I don't want to get political, but this is not referring to illegal migrants, but paid migrants who are here and they're buying their own insurance. They have an ITIN number, which is an individual taxpayer identification number supplied by the IRS. If they're from Mexico, Guatemala, Canada, and they have no social security number, they can still get an ITIN, which is the individual taxpayer ID number, okay? They can get impact health sharing, okay? We also offer a health and wholeness credit that is paid by impact to each individual member. Started back in July of 2024, each household can receive a credit of up to $100 a month towards their PRA balance. So this can be given to you and help lower your bill and your PRA for memberships, gym memberships, direct primary care memberships, naturopathic medications and supplements, acupuncture services rendered by naturopathic providers. Gym memberships, already mentioned that. So, if you're into acupuncture, this is what acupuncture looks like on the movie. If you've ever had a chance to watch the Nutty Professor with Eddie Murphy playing the part of Dr. Clump, he was trying to battle hunger and overweight and eating, with acupuncture. It's just a funny scene. Kind of lighten up the mood here. These are some of the residential and business commissions and points that you might see with impact health sharing. The share amount is going by up to $149. You get 2 points for that. 150 to 349, you get 4 points. 350 to 549 is 5 points. 550 and higher is 6 points. The commissionable revenue for individuals and groups up to 15 accounts is 40%. Large groups of 16 to 49 accounts is 25%. We do have some detailed training on Impact Health Share, and we can get into that as needed. And this is for the duration of the customer. This is not on just a 2-year term and then proof it's gone. This is for the life of the customer as long as they remain a member of Impact Health Share. In addition to the commissions that ACN pays out for acquisition of customers, these three partners have provided extra bonuses for ACN IBOs. Flash Mobile has refer a friend, so if you want to focus on mobile phones, you refer 5 or more Flash Mobile customers, you can earn a free line of service. Zoom Energy has a Power Up program. You refer 12 or more, you get an average bonus equal to the average of commodity only charges of those electric bills minus the taxes and the line charges. On the ID Seal, you enroll and help authenticate 5 or more customers with an ID Seal annual plan, and you receive a bonus equal to the cost of your annual service. So how much you can save year by year and how much you can make. Bonuses, the customer acquisition bonuses, they are paid out every Friday. Residual monthly bonuses are paid out every month on the 3rd Friday, okay? In your traditional business model, companies, they do a lot of advertising, online, media, print, whereas, you know, they spend a lot of money and they pay actors, you know, to, let's say, advertise their cars, or, you know, insurance companies, you know, like Mayhem for Allstate. You know, he gets paid very well for doing those commercials. The ACN business model is you are the personal person that's reaching out to either friends or family or a cold market or your existing client base. It's an income opportunity for you. It gives your consumers more choices. So you're not limited to one thing. You can sell electricity, or you can sell 2 or 3 different services as they need it. All you're doing is focusing on moving the money they're already spending in their budget to, you know, work with you. You can have them sign up as an IBO and build a team. If they don't want to, at least they can be your customer. All this is done by word of mouth. To get started as an independent business owner is only a one-time startup fee of $299 and then $25 a month for the back end office. You get a personalized website like you see on the lower right, training and marketing materials, business tracking and reporting IBO and customer support, and ACN loyalty rewards. The only thing that we have to do as IBOs is enroll customers and help others to do the same thing. You know, get a small group of people to start and then teach them to do the same thing, and it grows by multiplication. If you want to build a business, you know, strictly on addition model and go out and sign up a bunch of health share customers and members, you can do that. Or you can enroll some of them as IBOs and help them build their teams and customer base. And that's where you start getting exponential exposure in your business. And here we have a graph showing you how you can earn your personally acquired customer bonuses with your first 3 services. They can be yours or somebody that you've brought in as a customer on the retail side. You get your first $100 with your first 3 services, and that's usually pretty easy with you know, Zoom in some markets where we are in a deregulated electric market. Your phone bill, the Vivint Home Security and Automation, ID Seal. There's just 4 right there that I could think of off the top of my head. You get 2 more services added to that. You get the other $200, which is now 5 services. You get 200. And every 3 additional services, you get another $200 stacked on top of that. Those bonuses are paid out every Friday on what we call the CAB bonuses, customer acquisition bonuses. Again, refer to the ACN compensation plan for the complete details. You earn monthly residual income over here in graph number 2, depending on your level in the business, from customer qualified to executive team leader, regional coordinator, regional director, regional vice president, senior vice president, all the way up to senior vice president platinum. We only have 1 of those right now. We've got a lot of SVPs, but we only have 1 SVP premium. You can make up to 20% of the commissionable revenue, and that's paid monthly on your customers and on your downline. So here's another breakdown where you get 7 personal customer points from at least 3 services. You make your first $100, and you can do that in the first 24 hours. You get 2 more services. You've got 5 services and 10 points for a total of 200. So you get the other $100 added to that. And that's very easy to do. You get 3 more services and 16 points. You got another $200 going on top of that. You got $400. So it just keeps adding up. Every 3 services and 6 points, you make another $200. It doesn't stop at 11. It's just that it didn't have any more room on the screen to put. But this is unlimited. Just think what you could do if you was to enroll in 30 days. Let's say 30 or 300 new services and clients. Do the breakdown. It's not that hard to make money. So here's another panel here that shows you how you can get new customers in as of October, and you can make those commissions and customer acquisition bonuses. You can earn customer bonuses each month when you personally acquire customers. So if you don't get some in 1 month, it resets each month. The clock starts ticking again. You can go in and sign up some more. New IBOs can earn these bonuses based on the number of customer points and services they acquire in their first 30 days. Existing IBOs, those who are more than 30 days past their start date, can earn these bonuses based on the number of customer points and services they acquire in a calendar month. On the multi-location enrollments, impact health sharing, group enrollments, those do not count toward the bonus program, but you will get paid the commissions that are assigned to those. And here's another layout panel that you can look in the back office when you open up your account, start your account, and look at the weekly customer acquisition bonuses and how it breaks down for you as a regional coordinator, executive team leader, regional director, regional vice president, senior vice president, and senior vice president platinum. Okay, so they have a lot of legs that you can get in there. The income from your team's acquired customers is also a nice little plus. So as an ETL, executive team leader, when somebody signs up under one of your IBOs, you can make $50, and then it just goes up from regional coordinator, regional director, regional vice president, and senior vice president and senior vice president platinum up to $450 at the highest level, just on the bonuses. And then you have overriding residual income paid monthly on your customers. As your team grows, it just keeps getting bigger. Who was it that said, I would rather make 1% off of 100 people's efforts than the 100% off of my own? Was that JP Morgan or something? Some rich dude. But here we pay out up to 4%. commissionable revenue on all your overriding residual income. So it's 4 times better than the 1% from, who said that? Wasn't Dale Carnegie, JP Morgan? Well, somebody correct me. So to get started, you enroll as an IBO, get with the person who invited you, and they'll send you their link to their website. Participate in training, utilize our support system. We do online presentations like this. We do trainings, we do localized trainings and support in hotels, home training. We do home presentations for you. We do in-person and virtual, like we're doing here. So you acquire customers and you build a team. What it boils down to, and I don't want this to sound, passe or a cliche. Yes, you are in business for yourself, but you're not by yourself. And many people have given me a lot of support and training and help, and they're not even in my team. When I got started, I had people helping me that were totally outside of my team. I wasn't even in their team, but they still reached out. This is just what we do. We help each other. Also, on Sunday, Monday, Tuesday, Thursday, and Saturday, we have trainings at lpzoom.biz with the coach and cowboy. That's Presley Swaggerty and Randy Hedge. We have Sunday evening at 7 p.m. We plug in every Sunday for training. You can also bring a guest. Monday, we do the business presentation. So you can invite your guests to that. Have a goal to have at least one guest on each week. Tuesdays, the new IBO training. So a new IBO, he needs to get started. This is where you want to bring them in on a Tuesday. So today is the 7th of October, Monday. So tomorrow at 7 o'clock, we will have new IBO training. How to get qualified, how to get paid, how to build your team. You need to be on this training as soon as they enroll, okay? On Thursdays, we don't do anything on Wednesdays unless it's announced outside of the normal cycle. Thursdays at 7, we have the healthcare redefined with our lead team people on the impact training. And then, of course, Saturday, we have new IBO training again. So there's new IBO training twice a week, Tuesday and Saturday. And coming up this weekend, October the 12th and 13th, Saturday and Sunday in Orlando, Florida, we have the Elevate Conference. We have 4 conferences every year, just about every quarter. And we will be at the Omni Resort in Orlando, Florida, down there by Disneyland. So if you can make it down there, get down there and see us. We have a big event down there, half a day Sunday, full day Saturday. We have a lot of training, meet a lot of people on your team, bring your team members if you can get down. Any way you can get down there, drive down there, fly down there, walk, hitchhike, whatever you do, just get down there. You will grow so much and you will learn much more. So that's my presentation for ACN. I hope this has helped you understand some of the business about the Impact Health Share as I showed it to you. If you have any questions, reach out to the person who sent you this presentation, or if I sent this to you directly, you can give me a call, or I'll send you the information, my contact information, where you can call me on the phone and we can talk from there. Thank you again. This is Ernest Odell. I'm going to stop sharing and we're going to stop recording and say good night and see you on the other side.